Welcome to the Missouri Pharmacy Podcast, where we discuss the important issues impacting one of the most trusted professions in healthcare. From the opioid epidemic to opportunities in the profession of pharmacy, we discuss the issues pharmacists want to hear about.
Here to talk about pharmacy and benefit managers and the impact that they're having on not only Missouri pharmacists, but really pharmacists across the country. But obviously, Missouri Pharmacy Association is worried about and concerned about the impact that it's having on Missouri pharmacists, and most specifically small and independent pharmacists in communities across our state. I think we can very safely say that community pharmacists stepped up to the plate during the COVID and through the pandemic and really had a huge impact on communities. When we saw other medical facilities closing down, I mean, community pharmacists were there working with their patients, even though maybe the front side of the pharmacy was closed. They were very aggressively making sure the patients had access to their medicines, to other healthcare information, and really was the community resource in many towns across Missouri. One of the impacts that we see that is harming that relationship are third parties, and most specifically pharmacy benefit managers, and the impact that they're having on our small pharmacists. We just had an experience here in Jefferson City that many communities across our state have had to deal with, and that was one of our key independent pharmacy chains. Actually, 3 stores closed a few weeks ago just because of not being able to deal with the third parties, the PBMs, the pharmacy benefit managers, low reimbursements, and the low reimbursements that the PBMs caused, and just decided that they were going to move on and merge their practice and their patients into a larger chain and close the independents. That's a problem for communities, and again, now we're experiencing it here in Jefferson City. We have been trying to work aggressively with the legislature. There's some things that we can do. I mean, we understand that there's going to be a give and take in working with insurance programs with some of the insurance companies, but it's got to be a level playing field where all parties have the ability to participate in the marketplace. Our members aren't asking to be reimbursed at a higher level. They aren't asking for special treatment, but they are asking for the opportunity to be treated as other players within the market. So some of the things that we deal with on a day-to-day basis that we try to work with the legislature on is inequitable payment for services. We'll find that their in-house PBM pharmacies are oftentimes reimbursed at a higher rate than what our community pharmacists are reimbursed at for the same medications, for the same drugs. And that creates a marketplace where it takes business out of local communities and puts it in mail order facilities or mail order pharmacies in other communities. The other thing is insurance companies steering patients to specific pharmacies, telling patients that they are mandated to go through mail order, which most plans that is not the case. It's an opt-out, not an opt-in, meaning that you can continue with your local pharmacist. You have to opt out of that and go into the mail order. But steering of patients has been a huge problem, and we're seeing some of those issues also now in health systems and hospitals where patients are being steered to places other than the pharmacy within the hospital. And then just the inequitable way that pharmacists are treated, the audits that they have to comply with, and working with some of the third parties. We had done a pretty good job about a decade or so ago in setting some fairly high audit standards for third parties if they want to come into our pharmacists. It's no longer that they just show up and are able to do the audit. They have to make arrangements. They can't come the first of the month. There's specific requirements that they have to meet in working with our pharmacists. Again, we're not saying you don't have the ability and the right to come in, but you have to treat our businesses like any other business would want to be treated. Make arrangements, make appointments, tell them what you're looking for, and enable them to be able to collect the data so it's available when the third parties come in. So there's a whole host of activities that third parties bring to our members, and it just drives up the healthcare costs. Patients pay that cost. We're trying to work with the legislature to show, again, that we're not asking for special treatment. What we're asking for is a level playing field so that pharmacies of all sizes and in all communities can participate and take care of patients' needs as the patients are requesting.